Hi, my name is Maria. I am going to be your nurse practitioner today. Okay, how are you doing?
Good.
Okay, so what is your name?
Just
Okay, what brings you in today, Giselle?
I'm gonna do my physical.
Okay, how are you doing today?
Great.
Okay, okay, sounds good. So let's get started. If you can get up and then walk and sit here on the exam table. Okay, so do you know where you are at today?
The clinic.
Okay, and do you know what the time or date is?
April 7th,
Oh.
2018.
Okay, and you know who our president is?
Yeah. Donald Trump.
Okay, so patient is alert and oriented times three to person, place, and time. And okay, so and then her posture is erect and straight, and her gait was appropriate walking from the chair to the desk. And how are you? Are you feeling okay? Are you having any pain or anything?
No, good.
Yeah. Okay, and then her mood and affect is good. Okay, and then patient is dressed appropriately for the weather. It is a bit chilly outside. Okay, so I'm going to start by doing, I'm going to do a head to toe assessment or the complete physical, and we're going to start from the head and we're going to finish in your toes. Okay, so I'm going to start by assessing your scalp, okay, and her head. There's no visible trauma, no masses. Her hair is evenly distributed. Okay. Okay, and now I'm assessing her occipital lymph nodes. They are non-palpable. Okay, and then her skin is warm to touch, and her skin color is appropriate for her genetic background. Okay, and then okay, so I'm going to start by assessing her frontal sinuses. Tell me if you feel any pain where I'm touching. Okay, are you feeling any pain?
No.
No. Okay, they're non-palpable. And I'm going to assess now your maxillofacial lymph nodes. Your maxillary lymph nodes, I'm sorry. Okay, tell me if you're feeling any pain. No? Okay, so I'm going to assess your ears now. Okay?
Okay.
Does it hurt when I touch them?
No.
No? Okay, so I'm assessing the auricle. Okay, and then now I'm going to look into her ear canal and her tympanic membrane. Okay, so now I'm going to assess your auditory acuity, and what that means is I'm just going to assess your hearing and make sure that everything is good. Okay, so what I'm going to do is I'm going to whisper a word, and I want you to repeat it to me, but I want you to cover one ear at a time. Okay? So can you start by covering the right ear? Okay?
1, 2, 3.
Okay. And then the left ear.
1, 2.
Okay? And so now what I'm going to do is I'm going to place this over your head, and I want you to tell me if you hear equally on both ears.
Okay.
Okay? Yes, okay. And then now I'm going to do the ringing test, and what I'm going to do the same thing, but I'm going to do behind your ear, and then next to your ears. And what that does is assessing for sensory and bone conduction loss. Okay, so I want you to tell me when you no longer hear the sound. Okay? Okay. 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 So your cranial nerve number one. Cranial nerve numbers. Number 8. I'm sorry. Cranial nerve number 8, which is the acoustic, it's intact. Okay, so I'm going to start by assessing your eyes now. Okay. Do you wear corrective lenses?
No.
No. Okay. So I'm going to check your visual acuity, and I'm going to ask you to read this chart. It's a Snellen chart, and I'm going to ask you to cover one eye, and then read it to me, and then cover the other eye. Okay.
Okay.
So you can start reading.
E F P T O C L P E D P E C F D E D F C C P F E L O P C D D E F P O T E C O E F O D P C T.
Okay. So vision in the right eye. The left eye. The left eye is 20/20, and then now can you do the right eye?
E F P T O C O P E D P E C F D E D F C C P F E L O P C D D E F P O T E C L E F O D P C T.
Okay. And then vision in the right eye is 20/20. Okay. Awesome. So cranial nerve number 2 is also intact, which is the optic nerve. Okay. So now we will be assessing cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. Okay. So I'm just going to flash this light into your eye. Okay. Just look straight ahead. Okay. Pupils are constricting. Okay, that was nerve oculomotor, cranial nerve number 3, which is the oculomotor. Okay, so now I'm gonna ask you to follow this pen. Okay. Okay, and then okay. And then also tell me whenever you're able to see my finger move. Look straight ahead. Are you able to see it? Okay. And then tell me when you're able to see now. Okay. Okay, so visual acuity is also intact. Okay. So that's the ears, and there's also no drainage, and the eyes are aligned equally. Okay, awesome. And then so now I'm assessing her nose and her her nose, nasomucosa, okay, nasoseptum, and there's also no visible drainage. And I am going to assess cranial nerve number 1, which is the olfactory. I'm going to ask you to smell something and just tell me what you smell, okay? Okay, so cranial nerve number 1 is also intact. Okay, so now I'm going to assess your mouth. Okay, so lips are moist and pink. Can you open your mouth for me, please? Okay, teeth are white. I don't see any teeth missing. Gums are pink. Okay, can you stick out your tongue for me? Okay, awesome. And then open wide. Okay, tongue is also pink, and her tonsils, I can see her tonsils are present. Okay. Okay, and I don't see any evidence of gum disease or dental caries. Okay, so we're going to be assessing cranial nerves 9, 10, and 12, which is the glossopharyngeal, the vagus, and the hypoglossal. So first, I want you to say ah. Ah. Okay, swallow for me. Okay, so cranial nerve number 9 is intact. Now I'm gonna, can you open your mouth? And then, okay, cranial nerve number 10 is intact. And then now I want for you to move your tongue. Okay? Okay, and cranial nerve number 12 is intact, which is the hypoglossal. hypoglossal. Okay, and so can you move your neck for me, please? Okay, neck range of motion is intact. Okay, or it's out of it. Okay, so I'm gonna ask for you to bend your neck back, and then I'm gonna assess the thyroid. Okay, thyroid is non-palpable. Okay, and then the trachea is midline. Okay, I'm assessing her postauricular lymph nodes. They're both non-palpable, and then her preauricular lymph nodes, which are both non-palpable. Okay, I'm assessing the supraclavicular lymph nodes. They're both non-palpable, and then the infraclavicular lymph nodes, and they're also non-palpable. I'm also assessing the carotid arteries one at a time. Okay. Okay, and then I'm also assessing for jugular vein distension, and both veins are not distended. Okay, so I'm gonna start by I'm inspecting her chest, and there's no visible scars. Okay, and there's no accessory muscle use, so the patient is not breathing under distress at this moment. I'm going to ask you to take a deep breath. Okay. Okay, breath sounds are equal bilaterally. And then just breathe normal for me now. Okay, so I'm assessing the heart sounds. This is the aortic sound. It's on the right side, second midclavicular line. Okay, I'm assessing the pulmonic sound. And then this is also on the second midclavicular line on the left side. Okay, Erb's point. Third intercostal space, midclavicular line. And then I'm assessing the tricuspid, which is the fourth intercostal space, a midclavicular line. And then I'm going to lift your shirt up, and I'm just going to put this here. I'm assessing the mitral sound, or the apical sound, which is in the fifth intercostal space, midclavicular line. Okay, and I'm also palpating it, and it is palpable. Okay, and then I'm inspecting her breast. Okay, now I'm just going to palpate it. Okay, I don't feel any nodes or any lumps. Okay, and then I'm assessing the axillary lymph nodes, and they are also non-palpable. Okay, so I'm listening to her carotid arteries using the bell of my stethoscope. Okay, no bruit. And no bruit. Okay. So now I'm going to assess cranial nerve number 7 and cranial nerve number 5, which is a trigeminal nerve. So what I'm going to do is I'm just going to put this piece of cotton on your cheeks and just tell me if you feel it, okay? Okay. Awesome. Okay, so now I'm going to start by assessing her upper extremities, which is her arms and her hands. Okay, so I'm going to start by feeling her skin. I'm going to lift this up, and her skin is warm to touch, and the color is appropriate for her genetic background. I'm assessing her nails and her capillary refill. Okay, lesson 3. Okay, so can you extend your arms like this? Yes, good. Okay, awesome. Okay, So now I want you to hold my hands tight and just, or press as tight as you can. Hold them as tight as you can. Okay? Awesome. Okay, so now I'm going to push down on your hands and I want you to resist movement, okay? Good. Okay, I'm going to do it up now and resist movement. Okay, good. Okay, so I am going to check the radial pulses, and they are both present and equal. Okay, so now I'm going to check the brachial pulses. I'm just going to lift up your shirt, okay, your sleeves. Okay. Brachial pulses are both present and bilaterally, and then they're equal too. Okay, so I'm gonna do. I'm gonna use this reflex hammer, and I'm gonna assess two reflexes: the triceps, which is on the corner, or right here on your arm, and then the brachioradialis, which is here by your wrist.
Mm-hmm.
Okay, so let your hand loose. Okay, there we go. Okay, good. Okay, and good. Okay, and now I'm gonna do it on by your wrist. Okay, and then again by your wrist. Okay, awesome. So the reflexes are both there. So now what I want you to do is I want you to do this as fast as you can. Okay. Okay, awesome. And so now we're going to do another test. It's called the finger to nose. And I'm going to place my finger here, and I want you to touch my finger and then touch your nose. Okay? Okay, do it one more time. Okay, awesome. Okay, so now I'm going to assess the back of I'm going to assess your lungs posteriorly, which is on your back. Okay, so I'm going to start by inspecting your back. Okay, so inspecting her back, her skin feels warm to touch. There's no visible scars. There's no, she's not using any accessory muscles, so the patient is not in distress. And then, okay, I'm assessing her spinous process. Okay. Okay, and then so now what I'm going to do is I'm going to ask you to take a deep breath. I'm going to assess for chest expansion. So I want the patient to take a deep breath. Okay, and then breathe out. Okay, you can see the chest expansion. So that's good. Okay, now I'm going to start by assessing or listening to her lungs. And okay, take a deep breath. Take a deep breath. Okay, deep breath. Deep breath. Deep breath. Okay, deep breath. Deep breath. And deep breath. Okay, so now I'm going to check for tactile firmitis or firmitis. So when I do this, I want you to say 99, okay? Okay, give me 1 second. Okay, so now I'm going to percuss over the lung fields. Okay, and her breathing looks okay. Okay, and okay, so turn this side for me. And I'm going to assess the epitrochlear lymph nodes. Okay, and they're both non-palpable. Okay, so I want you to lay down. I'm going to ask you to lay down here, and what I'm going to do is I'm going to listen to your abdomen and then inspect and palpate your organs. Okay, Sorry, let me move this here. Okay. So I'm going to move this here, and then maintaining patient privacy at all times. So I'm gonna lift up your shirt, okay? And just right here to your abdomen. Okay, I'm inspecting her abdomen. There's no visible scars. It does not look inflamed. Okay, and then umbilica's present. Okay, so I'm gonna listen to your bowel sounds, okay? Okay. Okay, bowel sounds are present in all four quadrants. And then now I'm just gonna listen for brewing. Okay, so now I'm gonna percuss all four quadrants, including the liver span and the spleen, okay? So just put your hands right here, and then I'm just gonna lift it up to right here. Okay. Okay, so now I'm palpating the liver. Now the spleen. I'm percussing the spleen. Okay, so now I'm going to start by palpating. I'm going to start palpating lightly first, palpating the abdomen. There are no masses. Okay, do you feel any pain? No? Okay. Okay, palpating the liver, palpating the spleen, palpating the kidneys, okay, and palpating the aorta. Okay, now I'm going to do a deep palpation. Does it hurt? No? Okay. Okay, palpating the liver and deep palpating the spleen on the left side, and the liver is on the right side. Okay, and then deep palpating the kidneys. Do you feel any pain? No? Okay, and deeply palpating the aorta. Okay, awesome. Okay, you can get up now. Thank you. And then I'm gonna remove this. Okay, so now we're gonna proceed with your lower extremities. Okay, so we're almost there. Okay, so I'm gonna ask for you to take your shoes off. I can remove them. That's okay. Or whatever's faster. Okay, and also your socks. I'm sorry. Okay, so I'm assessing her skin. It's warm to touch, and her skin color is also appropriate for her genetic background. I'm assessing her toes and her nails. Okay, and then I'm assessing capillary refill on the left foot, and it is less than 3. Capillary refill on the right foot, and it's also less than 3. Okay, so I'm gonna assess the femoral are the femoral pulse, okay, and then also the inguinal lymph nodes. Okay, and now we're assessing the posterior tibial pulsus. Okay, and they're present. And then I'm assessing now the dorsalis pedis. Okay, and they're also equal and bilateral on both sides. Okay, so now I'm going to assess your joints. So can you move your legs front and backwards? Okay, awesome. Okay, so now I'm going to push against your legs and I want you to resist movement, okay? Good. And then I'm going to push upwards and resist movement too. Okay, they're both strong. Okay, so now we're going to do what's called the heel to shin test. So what I want you to do is just with the heel of your foot, just touch your shin of your, the shin right there. Okay, do it on both sides. Okay, and then now I'm going to assess the reflexes on your reflex here. Okay, 1, 2, 3. Okay, then 1, 2, 3. Okay, good. Okay, and then I'm gonna check the plantar reflex. Sorry, and I'm gonna do that by just on your toe or the lower part of your foot. Okay. Okay. Plantar reflex. Okay. So Babinski reflex is also it's negative. Okay. So now I'm gonna ask you to stand up, and I'm gonna ask you to touch your toes. Okay. Just bend down as much as you can without bending your back. Okay. So I'm assessing her spine. Okay. And you want to, move to this side. I'm assessing now for any kyphosis or scoliosis or lordosis. And, okay, good. Okay, so now what I'm going to ask for you to do is I'm going to do the Romberg test. So just stand straight like this and just close your eyes. And now we're going to do the pronator drift test. And what that does also, I want you to close your eyes or look at me first, and then I want you to stand like that straight. Okay? For about 30 seconds. Okay, awesome. Okay, now if you can sit back down, and I'm just going to check for some sensations, okay? I want you to tell me what you feel. We're going to do it for your upper and your lower extremities. Okay, so close your eyes. What do you feel? Soft. Soft? Okay. And then now? It hurts. Okay, so patient is responsive to painful and soft stimuli. Okay, now I'm going to do it on your toes, okay, or your lower extremities. What do you feel? It's soft. What do you feel? It's soft. Okay, and then what do you feel? It hurts. What do you feel? Okay, so patient is also responsive to painful and soft stimuli on the lower extremities. And so I wanted to take a moment and do some teaching with you. May I ask you about your diet or what you normally eat every day?
I eat pretty healthy meats, grains, and vegetables, fruits.
Okay, how much water do you drink per day?
Around 2 bottles.
Okay, so it is actually recommended that we drink about 7 to 8 bottles of water per day. Okay, now summer's coming up, so It's important that you stay hydrated. How much physical activity do you do?
Around an hour a day.
An hour a day?
Exercise.
Okay, do you do this at school or
Yeah,
when you get home?
school.
At school? Okay. That's very good. We also recommend 45 minutes to 60 of the physical activity. Okay, and how often do you visit the dentist?
Every 6 months.
Okay, that's also recommended. We want you to go for checkups and cleanses every 6 months. Okay, and are your vaccines up to date?
Yeah.
Okay, that's good. Did you have a flu shot last year?
Yeah.
Okay, awesome. Yeah, so I just want to encourage you to stay active, drink plenty of water, get vaccinated when it's due for your vaccines, as it is proven that they do prevent disease and the spread of infection. Okay, so that's very important. And then stay active and continue doing what you're doing. You look great.
Thank you.
And I want to thank you for allowing me to do your physical assessment today.
No problem.